I don't know if it's a myth or not, but people like to say that urine is sterile.
Yes.
Is it really sterile?
Generally, it's regarded as sterile.
If it's still in the body, I guess.
Yeah, if we do a conventional urine test, it should come back as negative, okay? But in elderly, especially those in nursing homes, if you do a urine test on them, sometimes
dirty.
bacteria grows in the culture.
Hello everyone and welcome back to Clinically Speaking, our medical podcast. I'm Marie and I have with me my fellow pharmacist and host, Evelyn.
Hello, I'm Evelyn, and today we have a very special guest with us today, Dr. Koh.
Hi everybody. Thank you for having me on this show. I'm Dr. Koh Litsa. I'm a senior consultant urologist at Urohealth Medical Clinic.
So maybe we can have our first questions to Dr. Koh, like what makes you want to pursue your career in urology?
Okay. So we're pharmacists, right? We shared some common lessons together in university. So as a medical student, I think you kind of know whether you want to go into the surgical field or the medical field. And for me, clearly it was surgery. So after graduating from medical school, we'll go through a few rotations and you get to try out. Actually, it's compulsory to rotate through a medical posting, kind of a surgical posting, and another posting at housemanship level. And then after that, we become medical officers. So this is my time, which is very, very long ago, okay? So it's quite different now with residency. But as I went through the different medical officer postings, it was urology that called out to me. The people in urology tend to be very relaxed, friendly, like myself.
Okay, what vibes? What match? Just so we know which is the specialty that is not so relaxed.
Okay, I think for the benefit of medical students, general surgery is a really tough posting. So I really am full of respect for my colleagues who are general surgeons. They are very busy, even through the night, operating on many different types of emergencies.
They have to know a lot of different
on-call.
Yeah.
Eventually, everyone will specialize, just like us urologists. But yeah, the training for general surgery is really very tough.
I see. So general surgery is difficult.
It's very difficult.
But urology is relaxed.
Urology is, we do have our emergencies. So it is quite stressful when the patient comes in with like a ureteric stone because the pain that the patient feels would be akin to like giving birth. So you have somebody rolling around the ground in pain, right? And then we have to get their pain under control and then after that manage the stone. But that is for another session, another conversation. Right?
Yeah, I think as a female urologist, I suppose urologist is like mainly dominated by men. Is that true? How many perhaps in your cohort?
Because in my time, which is very long ago, again,
it's not that long.
There were, when you get into med school, there was actually like a limit to the number of females that could get in. Now it's so much better already. In fact, I think probably 5 to 10 years after I got into med school, they kind of made it equal. So in my time, it was like 1/3 females and then 2/3 males. So for this generation, at least, there are less female doctors. But the younger ones, I think you're going to see more female urologists pop up.
Yeah. Like more than 30%.
Now it's because females do better at the exams, right? We are very hardworking. So if you go in by academic merit, I think there are more females than males in med school now.
I just feel like urology itself tends to be a male-dominated field.
I guess.
Is that the real case? I mean, just like I think orthopedics also seems to be a very...
Yeah, so I think it will only call out to a select few females who actually enjoy the specialty. Yeah, so... But there are really more younger female urologists now. They are just in the public hospitals, So you will see them. And it's good for all female patients, right? Because some of them prefer, they are more comfortable seeing a female doctor.
Yeah, especially for all these like genital urinary kind of conditions. It can be very awkward for people to come to you.
Sometimes, yes. And sometimes for males, right? Some males actually feel more comfortable seeing a female urologist.
Oh,
yeah.
That's not so paiseh.
Yeah, I feel maybe we don't judge them. No, my male colleagues are not judging them too, okay? Sorry. Yeah.
So majority of your patients are like females or like males?
I think I have a good mix of both male and female patients. Yeah.
So what would be one top condition that you see?
Oh,
The
I
top,
do.
top.
I do see a lot of patients with recurrent urinary tract infections, and I think that's the topic that we are interested in talking about today, right?
Urinary tract infection itself is pretty common, right? So what makes it such that someone have to go see a urologist rather than their general practitioner?
Yeah. Okay, that's a good question. For females, about 50% of all females will experience urinary tract infection in their lifetime. And then 20% of these women may go on to develop recurrent urinary tract infections.
It's like again and again.
Yes.
You can-
So there's actually a medical definition for recurrent urinary tract infections. It is 2 or more urinary, I'll just say UTIs, it stands for urinary tract infections. So 2 or more UTIs in 6 months or 3 or more UTIs in a year. So if a patient has this recurrent UTI, then the GP will generally refer the patient to see us because it is our job then to work up if there is an underlying problem leading to this condition and to try to help the patient to get over this problem and prevent further episodes. Yeah. But if it's your first episode of UTI, I think it is quite reasonable to go and look for your GP who will probably be able to treat you, and hopefully that will be your only episode. Yeah.
Okay, that's for females, right? Because for men, it's very different.
Very different.
Yes. So men generally should not get urinary tract infections in the first place, right? So if you have any male patients with UTIs, they should come and see us, and we should work up and see what's
Upon
going
the
on.
first episode.
Yes, I think it would be, it's recommended, yeah.
It's quite different between like males and females in this way.
Yeah, the female urethra, I brought along a little friend here. I don't know whether you can see, but so the female urethra is the channel that the urine comes out from after exiting the bladder. It is much shorter compared to a male urethra, which I have another diagram, which is much longer. So it's way easier for bacteria to ascend up a female urethra and cause an infection inside the bladder versus a male.
Because of the shorter distance.
Yes, the shorter distance, that's right. And you know, it's so close. So we have a few openings here which are very close together. So the urethra is the opening for urine to come out. That's right at the front for us females. And then followed by the vaginal opening. And then right at the back is the anal opening. And in the 2 openings behind the urethra, organisms, good and bad, can reside there. Yeah, so it's very easy for them to make their way forward.
It's a higher risk to get UTI.
Yes,
I mean,
yes.
if it's higher risk for females to get it, then why is it more dangerous for men to get it?
Okay, so if a man gets it, then it suggests that there may be something anatomically wrong with the individual. Sometimes there isn't a problem. Or if a man gets it, then it may be prostatitis, especially if they are young. And that is a little bit harder to treat. Yeah. So you want me to go on to prostatitis?
I think we'll stick to UTIs at this point. So recurrent UTIs, and you said that they sometimes it's due to underlying causes, right? What kind of like specific underlying causes? Because there's so many causes for UTI, like if you don't wipe properly, if you don't pee up, if you hold your
so
pee and
I
all
have a
that.
few general tips for patients if they want to avoid getting recurrent urinary tract infections. First is hydration. Okay, so if there is no medical contraindication to drinking enough water, like some people have heart failure, some people have kidney failure, then they actually are on fluid restriction. But if not, then a person with recurrent UTIs should drink at least 1.5 liters of water a day. Okay, it'll be better if they can hit 2 liters.
To flush it out.
Yeah, so that there's more fluid to flush out whatever organisms that have gone in. Okay, they don't have to overdrink. So you know,
1.5 is good.
two would be good.
would
Okay,
be good.
so you know, in clinical practice, I have patients that come to me and they only drink 500 mils of water a day. You know,
How do you do that?
yeah, so you have all sorts of people. And then I had medical students that I was teaching last time, and the whole tutorial they're just drinking, and they have a big bottle coming in, and it's habitual. So these people can actually drink easily 4 liters of water a day to 5 liters. And there's such a thing as over drinking. So we don't have to overdrink, okay? Just about 2 liters would be good. So that's one tip. Now, the next is if a person, especially female, is sexually active, then she and her partner should wash before intercourse. She should also pee and wash after intercourse, okay? So that flushes out whatever bacteria that may have climbed in during intercourse. And then usually we would ask the patients to wear breathable underwear. Yeah.
So big one like cotton.
Yeah, so a lot of materials are not breathable, and that allows sweat, and there's a turnover of skin cells as well. So that would be like a haven for bacteria to reside in, and it can multiply there, and then there's more of it to climb up the urethra. So a lot of women wear panty liners. So if
Recommended? Not recommended?
it's okay because sometimes they discharge, and then the discharge on the underwear makes the underwear dirty. With the panty liner, you don't have to change the underwear. But I'll just advise them to change the panty liners when it's soaked, when it's dirty, And if they're having menses, to also
Change their
stay.
pad
Yes.
regularly.
So I've had some younger girls, because they will just sit in it and it is soaked with clots, right? Yeah. So I ask them to just change it regularly
just help lah.
on the heavy
I mean,
days.
even if
Like a few times a day.
A few times a day, that's right. So those are the few tips. What else? Let me think. It will come to me.
For example, in terms of anatomical causes, is there when you go into do a workup, like what may you expect to see, or what are some things you're looking out for?
Okay, so we would exclude things like stones in the urinary tract.
That could cause
Yes, because the stones basically they are a hiding place for the bacteria also. So even after we've cleared the bacteria from the urinary tract, it can surface again. Yes, so we would usually do some form of imaging to make sure that there isn't a problem with that. Sometimes some patients have an obstruction of the urinary tract. The urinary tract is actually it starts from the kidney. Then there are two tubes called ureters that drain into the bladder, and then you have the bladder and then the urethra. So anywhere that there's an obstruction, then the urine doesn't clear so well, and that in that location, yes, it's stagnant. Then the bacteria can cause an infection more readily.
And actually, wasn't there this I don't know if it's a myth or not, but people like to say that urine is sterile.
Yes,
Is it really sterile?
generally it's regarded as sterile.
If it's still in the body, I guess.
Yeah, if we do a conventional urine test, it should come back as negative, okay? But in elderly, especially those in nursing homes, if you do a urine test on them, sometimes
dirty.
bacteria grows in the culture, but we don't necessarily have to treat them, especially if they are not
symptoms.
Yes, not having any symptoms, or if they are not planned to undergo any urological surgery, then there is no benefit. There's no benefit in treating them then. Rather, we wait for the symptoms to manifest first, or if there's an indication like we're going to do a scope for them, then we will clear the bacteria in the urine. So the answer is yes and no to that question. Sometimes the bacteria level is also very low, and it may be embedded down, and in only selected cases we might actually send off a specialized urine test to look for bacteria DNA. Yes, but it is really we need to have a detailed discussion with the patient first, because you don't want to overdiagnose something and overtreat something as well. Yeah.
How about the treatment wise? Is it same for the
Regular
first time
UTIs,
recurrence?
So when you go to a GP, it's very likely that the GP will just do a dipstick because the result comes back quickly, okay, and that's valid. That's good enough, all right. And then the GP will give empirical antibiotics. That means based on guidelines, and in that particular location where the patient lives, what would work. And by and large, most people will recover with that. But if you get a recurrent infection, then it's highly recommended that a culture be done. Now, culture is a test where they try to identify the bacteria that is growing in the urine. And then we not only have the name of the bacteria, we have the sensitivity results. I'm sure you all know, right? Being pharmacists. And then that is really helpful, because then you look at the results and you might discover that the antibiotic that was initially given
Didn't work.
Yes, didn't work because the bug is resistant to it.
So you changed the
Yes, then
strategy.
based on the culture results, we would change the antibiotics and treat accordingly. So
Does that usually work?
yes, it should work. It should
How
work.
many % of the time before the thing comes back?
Most of the time. So then we come to patients with recurrent infections, right? Okay, so sometimes, so when they come to see us, we do imaging, we make sure there's nothing wrong with the anatomy, then we check if they can empty well. So sometimes for whatever reasons, they are not emptying their bladder well.
Even though they have the urge, right?
Yes, so they can feel, and sometimes they can feel that they didn't empty completely, sometimes they can't.
I thought it's just a symptom of UTI that you have the urge, but you also feel like you're not emptying.
Yes, that is a symptom, but there are patients maybe because of weakness of the bladder, they can't empty well, or sometimes after giving birth, they have weak pelvic floors, and then the bladder droops down a little bit, then
they can't really
they
tell
can't empty well also. So we have this test called a Uroflow, which is just a simple test where the patient pees in our toilet, and we capture the urine, we generate a graph, we see how well they are emptying the bladder. It's a very simple test
I
actually.
always thought that was just for guys, like
Our
for the
females too, and then we do a
feminas.
scan and we check how much urine is left behind after the patient has peed already. And if the amount is significant, then we know that that can contribute to the recurrent infections as well. So both males and females can undergo this very simple test. So this is just one of the tests. So we will do urine tests to identify the bacteria, the culture, imaging, some form of imaging. Usually we do a Uroflow, which I just described, and sometimes we will do a scope of the bladder too, where we'll make sure that there are no tumors in the bladder, because rarely we might find one, okay? Yeah.
Some lifestyle checks on the patient as well.
Yeah, so we go through lifestyle, like the habits that I was telling you earlier, to try out to embark on all these things first, to be cleaner. Okay, so generally, douching is not recommended.
Yes.
Douching is like a flushing of the vagina for some of our male listeners and even female listeners who may not know. So douching is not recommended because it actually gets rid of the good bacteria in the vagina as well.
Okay.
So generally, washing will be sufficient. Some of my patients I discovered don't use any soap at all.
Just water.
Just water. And in some patients, that is not enough, because when I actually check right below, there is still a film and visible thick film of old sweat and, cells that are just stuck in between the skin folds.
Just gotta wash thoroughly.
Yes, you don't have to wash excessively, okay? And I don't recommend that patients like at every trip to the toilet wash it, Otherwise, you'll develop eczema, some other problems associated with overwashing, right? Yeah, but at least once a day, I'll recommend using a gentle soap. If patients are worried about using conventional soap, then there are those soap-free options like QV soap,
for eczema.
Cetaphil, to just wash the area so that it's a bit more thorough, the cleaning, and then you get rid of all that grime that can potentially have bacteria hiding in it also.
Right. But for these recurrent cases, have you had patients who do their best? Did all the lifestyle changes?
Yes. So by the time they come to see me, right, they have done everything right already. They have even taken cranberry supplements. So cranberry, you must have done some reading, right? It is like, does it work? Does it not work? Okay.
Prevent the bacteria from adhering to the side.
Yes.
It's famous for UTIs.
Yes. So cranberry can help to decrease the stickiness of bacteria to the bladder wall, so that even though a little bit can ascend up, but if it doesn't stick to the wall, it doesn't attach itself, then it gets flushed out when you pee again. Okay, but some studies have shown that it works, some studies have shown that it doesn't work. By and large, I feel that it is okay for them to take it if there are no contraindications. So
People can be contraindicated with cranberries.
so if you have you have kidney stone problems, because cranberries are higher in oxalate content, then I would tell them not to. And then if they are diabetic, I would ask them not to drink large amounts of sweetened cranberry. I take the capsule. Or if they have gastric problems as well, taking a lot of the juice will worsen the gastric issues. And if they're taking certain medications, I'm sure you all know, right?
I'm not meant to check what's contraindicated with cranberry juice.
Yeah. Okay. So certain medications we will not. We will be hesitant to ask them to take cranberry. But if not, most of the times I do recommend that they try cranberry, and it can be coupled with probiotics, try to restore the good bacteria.
I've seen a lot of those probiotics on the shelf, and then they'll say this is for women, this is for general health, this is for gastric.
Yeah.
So the women one, do you find those legit? Would you recommend someone to take
anything
those?
So I sometimes I'll ask them to take kombucha if they want, or so.
I like
After
kombucha.
that, or if you take yogurt. Any form of probiotics is fine with me, okay? So it's just to restore some of the good bacteria back onto the body, because these women with recurrent infections, they have taken many courses of antibiotics. A lot of the times, they would also have had a fungal infection, like of the vagina, as a result of
because of the overtaking of the antibiotics.
Yeah, so that is another problem. So
Probiotics, when you take it orally, how does it help?
It just, it goes into the gut, right? Yeah.
can survive.
It can survive, it just
It finds its way there.
finds its way into the various organs. So when they come to see me, usually these patients have tried everything already. They are very, very clean, okay? They have washed. And many times they also are so scared to have intercourse because it's not uncommon to have the UTIs after intercourse. Although some women with no intercourse at all can get it. So then we will discuss preventive options.
Yeah.
So you know, just now earlier we were talking privately, we were talking about preventive antibiotics.
Yeah, that's very common, I think.
Yes.
Usually that's what we hear and that's what we dispense as well.
Yes. So in the European and the American guidelines, there is a role for preventive antibiotics. So when the patient has received the therapeutic course of antibiotics to treat the active UTI, means they take the full course, a proper course to clear the UTI, and then they are well already, we give them a nightly antibiotics just to take even when, you know, there are no symptoms at all, a very, very low dose, just enough so that the UTI doesn't flare up, okay? And actually there are two forms of preventive antibiotics. One is to take it daily, and the second is if there is
The standby course.
no, not really. But if it's clearly associated with intercourse, then they time it with intercourse.
Or after, before?
Okay, so in the guidelines, usually they'll take it after. But for me, I recommend for my patients to take it before intercourse, so that it is there already in the bladder when the bacteria gets pushed in. So usually intercourse is at night. I ask them to take it in the evening, and then the next morning I will ask them to take one more dose. Yeah, and it has worked pretty well.
That's kind of
so it
intensive.
is very, very effective. Okay, and it's generally very safe. But the concern is you take long-term antibiotics. Are you going to disrupt the natural flora of your body further?
Is there a risk of antibiotic resistance also if you keep taking the same antibiotic?
Yes. So with the antibiotics that we use for preventive treatment, right? The chance of developing resistance is quite low, but not zero.
Okay.
So definitely the concerns about developing resistance is very valid. And so we have another alternative now, which was
Very advanced.
Yes, which is
UTI vaccine.
UTI vaccines. People are usually very surprised to discover that it's not like rocket science. It's not something that just came out yesterday. Okay, one of the vaccines that we currently use at our clinic is tablet that contains 18 strains of heat-denatured E. coli. So E. coli.
Tablet.
Yeah, it's a bacteria that is responsible for most of the UTIs that people get, okay? And E. coli is normally in the gut, all right?